Okay, so we're just waiting for participants to come into the webinar. We'll give people a minute or two just to join. Okay, people are just coming into the webinar as I speak. So we'll just wait for everybody to join the session and then we'll make a start. Okay, I think quite a few people have joined us now. So good afternoon, Penang Da, Croesio, and welcome. So my name's Claire Morgan. I'm Director for Carers Wales, and it's my pleasure to welcome you all to this afternoon's webinar on co-production with unpaid carers. So thank you for being with us and thank you for your interest in this subject. So Carers Wales is the national membership charity for unpaid carers. We are part of the UK charity Carers UK, which is nearly 50 years old now. And a key element of our work is representing the voices of the 310,000 carers or more, as we suspect, across Wales. So today's webinar launches the findings of some research that we've undertaken on co-production with carers across Wales. We will be publishing the full report next week, and of course everybody booked on to today's webinar will receive a copy. So to start off with, we'd really like to thank everyone in the local authorities, regional partnership boards and the third sector organisations who took the time to complete the information gathering survey on which the research report is based. So just in terms of kicking off today's webinar, refer back to Co-Production Network for Wales, who defines co-production as professionals working in partnership with people who have lived experience to develop solutions and to develop solutions to challenges in public services and the communities in which they live. And they suggest that effective co-production is underpinned by 5 key principles. So firstly, valuing all participants and building on their strengths. Secondly, developing networks of mutual support. Thirdly, doing what matters for everybody who's involved. Fourthly, building relationships of trust, sharing power and responsibility. And finally, understanding that people can be change makers and that organisations can really enable people to fulfil that role. So as many of you will already know, co-production is a key cross-cutting theme of the Social Services and Wellbeing Act. As a charity, obviously committed to representing the voice of unpaid carers in Wales, we are also committed very much to the priorities around co-production and obviously how carers in Wales can have a role in decision making, service planning and service delivery. And we believe as a charity that this can be a win-win for everyone if it is done successfully. However, we also recognise that a meaningful co-production is often difficult to achieve both for the professionals involved and carers themselves. So today we are going to be sharing some of the challenges which you've shared with us through the research that we've done, but we'll also be sharing some examples of really good practice which is happening across Wales and hoping that that will be shared and taken on by other areas within Wales. And obviously we'll also be sharing our research recommendations around suggested improvements as well. So before we kick off and I ask Jake Smith, our policy officer, to give an overview of the findings, I'm really delighted to welcome Tay Tyler, who is the carer representative on the Cwm Taf Morgannwg Regional Partnership Board. And Kay is a key member of the parent carer group called The Grapevine, which probably many of you have heard of. So once both speakers have presented, there will be an opportunity for questions. So please post any questions you have. There should be a Q&A button at the bottom of your screen. If you could pop your questions in there and then we'll come to them at the end. So without further ado, Kay, really delighted to welcome you today. Thank you.
Thank you. Good afternoon, everybody. As Claire said, my name is Kay. I have two children, and my son is 34 and was born with a rare syndrome called Cornelia-de-Lange syndrome, which has an associated learning disability. I also had to care for my dad, who was living with dementia. Now, I'm a member of a group called of parents and carers of adults with learning disabilities called the Grapevine. And Jake asked if I could come along today and tell you a little bit about our group's experiences of co-production. So the group had its very first meeting in July 2017. And as a group, we decided early on that we didn't want to just meet for a chat and a coffee and cake. We wanted to meet for a purpose, to try and make a difference, and to try and make sure that our voices were heard and listened to by those providing services for our family member. What we've discovered over the last few years is that we are certainly stronger together as a group. Gaining an understanding of our rights as parents and unpaid carers under the Social Services and Wellbeing Act really was huge, a huge discovery. It empowered our members, and it helped us to build relationships with the local authority, with the health board and other service providers. And we now have representatives sitting around the table helping to shape services at a local and regional level. We feel we've been well supported by our network, and especially by, with People's First, which advocate for people with learning disabilities. So this afternoon, I wanted to share one example of our experience of good engagement and co-production. And we really are excited as a group about this opportunity, and hope it will help many other unpaid carers outside of our group as well. So in 2017, our local authority made changes to the learning disability social work team, and that left many family members without an allocated social worker. And it caused a lot of distress for our parents and carers, and we raised our concerns with the local authority. Thankfully, the team was reintroduced in April this year, and Grapevine members have had the opportunity to work with the local authority on a vision for the service. So initial meetings were held online back during COVID, and it's not everybody in our group is comfortable with online meetings such as this. So we also spoke to members on the phone, we sent out emails, letters, we gathered in questions that members wanted answers to about the proposed new service, and also our members' thoughts on a vision for the new team. So we presented this information to the local authority, and it was things that mattered to us as unpaid carers. Things like not having to repeat our story, knowing the names and faces of the new social work team, knowing who leads and manages the team, a simple and easy contact system that's accessible for all. So moving on from that, last month, the team leaders of the new team came out and had informal face-to-face meetings with our members. They gave us details and contact numbers for the service. We shared stories about how hard it has been without this service, and discussed the vision for the future, and most importantly, agreed some next steps. The team leaders were honest with members about current timescales for things like annual reviews, and this honesty and this transparency was greatly appreciated by our parents and carers. It helped our members to understand the constraints that the social work team has as well. So a number of small actions came out to the meeting, and a week later, just a week, I had an email from the team leader with an update on some of those actions, and it was brilliant to share these with members. They could see some small steps had already been taken, and this type of co-producing and good communication is really what makes a difference. It helps to build trust. Our members felt valued, listened to. They were engaged in ways that suited them, and there were quick wins and quick results. It's still a long way, to go as the service is reintroduced and redeveloped, and we're really looking forward to working together, monitoring the new service, feeding back from our end, and we know that the local authority social work team are really keen to do this as well. I am also carer rep on Cwm Taf Morgannw's Regional Partnership Board, and they really are doing some superb work on setting solid foundations for co-producing services with citizens. Our members of the Grapevine had the opportunity to attend a really excellent range of engagement events, including hackathons, which were used to complete the population needs assessment and produce an RPB area plan. And the next stage is to work together to drive change forward. And I'm sure we're going to continue on this co-production journey. It's good to be a part of it. And our RPB, Cwm Taf Morgannwg, has completed excellent work on identifying the barriers to engagement and co-productions with recommendations on how to overcome them. I'm going to flag up some of the materials that has been produced now. And this guidance is available to share for others and to learn from experiences that people have had. And there's no need for anyone to start from scratch. So I feel it's just really important to learn and to continue to learn how to work with people to develop services rather than just developing services for them. Taking people with lived experience on the full co-production journey rather than just taking them halfway. We have the lived experience, so we really do have a great deal to offer. And the powerful message that's in the Social Services and Wellbeing Act and the principles that underpin good co-production really can make a difference to people's lives and when they're applied well. Personally, I've experienced really good, bad, and some absolutely awful attempts at co-production, but I'm still involved because of events like this and the willingness of service providers, local authorities, health boards to change some years of embedded practice. There's a real sense that people want to find a way to do this effectively, and the numbers that have signed up and are present today is just proof of that. Our members understand it takes time. It can be very frustrating reminding people about the principles of co-production, but it is definitely worth it. And I'd just like to wish good luck to everybody out there and enjoy the meeting, and thank you very much.
That's absolutely brilliant. Thank you so much, Kay. I know that you're so busy, and I really appreciate you giving the time to come and talk about your personal experience of co-production today. So thank you. And Kay will be on hand to answer some of the questions at the end as well. So thank you, Kay. We're going to move now to Jake Smith, who's Policy Officer at Carers Wales, who's going to give an overview of our research findings. Thanks, Jake.
Thank you, Claire. I will just share my screen and we will kick off. Okay, so good afternoon, everyone. Prynhawn da I bawb. Jake ydw dwi'n swyddog polisi yn Gofalwyr Cymru. I'm Jake Smith. I'm the Policy Officer at Carers Wales. I'm very excited today to be talking to you about the research that we've conducted into co-production, as brilliantly introduced by Kay Tyler just now. So, as Claire set out, co-production has a strong basis in the Social Services and Wellbeing Act, and she talked about the language it contains about empowering people to get involved in creating services and to have a meaningful voice. Now, the basis of co-production in relation to carers in Wales has actually recently been restated in the Welsh Government's Charter for Unpaid Carers, which was released just last year. And in that charter, it says that unpaid carers should be equal partners in the creation of policy and services. And it goes on to say that co-production means giving carers a voice in policy and service development, but also through to planning and delivery, and even in associated fields like research and training. And that very much echoes, but adds a greater level of specificity to what is contained in the Social Services and Wellbeing Act. But it's all about making sure that carers have a strong voice in the services that they receive. And as stated in the Charter, in policy development, in service development, and in those areas mentioned. Now, it's useful just to be really clear about what we mean by co-production today. The language of co-production, as I'm sure you are aware, is sometimes used interchangeably and linked to that principle in the Act of voice and control. And sometimes it can be used to refer to an individual's conversations about their own care and support package. For example, maybe a carer working with a social worker, perhaps to decide, the support that's right for them. But this research today is focused on co-production at the service and policy level, as set out in the Welsh Government's Charter, being equal partners in the creation of policy and services. So it's that level that we're discussing today. So this research came about because Welsh Government asked Carers Wales to research the picture around co-production with unpaid carers in Wales, and then to make recommendations. So at the end of last year and at the beginning of this year, we sent round an information gathering survey to contacts all over Wales, both at the regional level and at the county level. And we received 42 responses. So we were really pleased with the response we received back. That included all 22 local authorities, but also various other responses. For example, some from regional partnership boards, some from county voluntary councils, third sector carer services, any professionals who were involved in co-production with carers. And we then went back to them more recently in August of this year to see whether anything had changed and whether they wanted to provide any updates. We then supplemented that with desktop research. So looking at things like local authority websites to see whether there was any additional information that could fill in any gaps that had been offered. And we shared regional content with carer representatives on regional partnership boards like Kay, just to see if it chimed with their experiences. But I want to be clear at the beginning about what this research and the coming report is, and also what it isn't. So this isn't a comprehensive review encompassing every instance of co-production in Wales, and we don't pretend to have heard about all of them. We're not seeking to evaluate all of them. That would be a very significant piece of work, engaging with many different stakeholders. But what this is an overview of co-production with carers in Wales, and looking at some of the challenges, but also some good practice that we can glean from the responses, analysed in light of co-production principles, and based on the information that we gathered through this survey. So hopefully it will provide a very broad overview of the activity, much of the activity around co-production with carers. And it's also really important to distinguish between consultation and co-production. So what you can see on your screen here is the ladder of participation, and it's often used by the co-production network for Wales. And I think it does a really good job of setting out how consultation exists at one level, but how co-production exists at a higher level. And really, I always think that the best way to describe it is consultation might be inviting people in relatively late in the process. So maybe, you've developed a plan, you've consulted with other professionals, you've written it up, you've maybe got costings, a lot of work has been put into it. But then towards the end of the process, maybe you briefly consult on, say, the draft proposals or the draft tender, for example. But co-production is about a strong voice for citizens at every stage of the process, including, as the Charter says, from the early stages through to those final decisions. And there is evidence that confusion on this point is quite widespread. So the Welsh Government commissioned independent evaluation of the Social Services and Wellbeing Act found that the distinctiveness between consultation and co-production was often not appreciated by many of the organisations and practitioners they spoke to. But I think, as so often is the case, an unpaid carer put it best. And in the evaluation, they said, co-production is kind of flung around when actually most of the stuff is consultation. So we're really clear. We tried to sift through the responses we receive and hopefully hone in on those that actually seem to be real and strong co-production. So in our survey, we asked those who filled it out how co-production operates in their area. What are the mechanisms? What are the structures? What are the groups? What does co-production look like? And what is set up to facilitate that? And that's because the Social Services Act says that local authorities should establish transparent arrangements for co-production. And it also says that organisations the local authority partners with, for example, a third sector service they might have commissioned, they're also expected to be able to demonstrate co-production in their work. So from the start, many local authorities, they told us that they do, lots of different engagement events with carers. Many of them talked about surveys they do with carers. Many of them talked about feedback mechanisms, say if someone has engaged with a service. But what we found was perhaps a bit closer to co-production was that around half of the local authorities in their responses indicated that they appear to have a form of group or a forum whereby carers can come together and collectively have a say on services. And these are groups that meet regularly. And again, they give carers that opportunity to come together and comment on services. And you can see some of the examples that we received on the slide there. Now, these groups are interesting because on the one hand, there's much to be positive about them, because when you have a standing and consistent mechanism for carers to get involved, to have a say, to come together, then that, of course, is conducive to co-production. But I have to say, from the responses we received, it was unclear whether these groups could fairly be categorized as co-production, or rather really just as consultation, because it wasn't clear whether these groups necessarily had any formal powers or a formal role in the decision-making structure of their local area. So absolutely a strong basis, but perhaps a question mark over whether they quite meet that standard of co-production. But there was absolutely some unambiguously good practice. So we found that several regional partnership boards have dedicated carer committees with carer representatives. So regional partnership boards, they have a legal obligation to have carer representatives at the top level on the board of the regional partnership board. But we could see that many RPBs have actually gone a step further by creating sub-boards and groups within their structure that have carer representatives on them. So that was really good to see. There's also some apparent good practice in Swansea. So we were told about the very active Swansea Parent Carer Forum. And the Parent Carer Forum gives a voice for parent carers in the Swansea area. and it's received support both from the local authority and the local county voluntary service. And in Swansea, there's even a local co-production network. So we could see some real good signs of co-production in that county. We could also see in the West Glamorgan Regional Partnership Board that they've actually established a carers liaison forum. So that's a forum where carers can come together on a regular basis to discuss issues that matter to them and directly feed into the work of the Regional Partnership Board. And we could also see that the Regional Partnership Board is actually recruiting for additional carers to be represented on a number of sub-boards and committees within the RPB structure. For example, on things like neurodiverse conditions, learning disabilities, mental health, and others. We were also really pleased to hear in Powys about their carers steering group. And that brings together unpaid carers, but also representatives from the local health board and the local council as well. And it's worked on things like regional integration funding, and it has a rotating chair, including carers within that. But we know that co-production often, of course, isn't straightforward, and we know that often carers need support to fully engage in the process. So that's a question that we asked in our survey. So we asked organisations who responded what support they provided to unpaid carers to facilitate their involvement. It was clear from our responses that the majority of these meetings are held online. And where they are held in person, there's provision for expenses or paying for taxis, for example, for carers to attend. And in-person meetings, although there might be the travel consideration, they are really important for carers building relationships with the decision makers and the officials that they're working with. So actually, there's much to recommend having that in-person dimension to build that relationship and that important good rapport. Several areas told us that they provide respite or fund replacement care to free up some of the time of the unpaid carers so they could fully engage in co-production. And that's obviously really positive to see. Interestingly, when it comes to remuneration and reward, some areas said they use, for example, the time credits system to provide a form of reward for unpaid carers who have engaged. But we did see that there was, very much a mixture of views on this, because some respondents said that they found there could be unhelpful implications for things like benefits, for example. Or if it's a time credit to use a service, then you actually need sufficient services for a carer to take advantage of them. Other practice included sending Amazon vouchers to carers, and one council even said they send flowers to carers. So I think there's some really inventive ways to try and provide a bit of reward and recognition. Some good practice could absolutely be seen in the West Glamorgan Regional Partnership Board, which told us about how they have dedicated staff resource to support carer representatives and other volunteer representatives. So a dedicated member of staff who can work with these representatives to understand what barriers they might be facing, to understand what support could be put in place, and help them have a rewarding and effective engagement with the decision making in the Regional Partnership Board. But I wanted to point you towards hopefully a useful resource. So last year, Carers Wales worked with the Welsh Government, but also with carer representatives on regional partnership boards to create a good practice charter about supporting carers and volunteer representatives to fully engage in co-production. And this charter, it has advice on, for example, the role of the chair, how they can welcome in representatives. It talks about accessibility, so providing things like summaries of documents, easy to digest versions, and the importance of relationships. So how you can help the volunteer representatives and the decision maker, the service leads around the table to build that positive relationship and that good rapport. There's a lot more in the charter, so I'd recommend you have a look, and I'm sure we can get the link to you. But it's relevant not just at the regional partnership board level, at all levels, we're trying to support people to get involved. But we also know absolutely that there are many challenges to achieving good co-production and many challenges to having carers properly involved in the process. Now, understandably, a representative from Torvine said that carers are often just so busy with their caring role, and so many have so little time to engage in co-production. And I'm sure that won't come as a surprise to anyone here. But it's perhaps even more acute for those carers with the most intense caring responsibilities. Because if you are caring for 30 hours a week, 40 hours, 50 hours a week, if your caring role is really intense, then it's probably even less likely that you'll have the time to attend meetings like this or get involved in events and co-production opportunities. You know, it's those carers with perhaps with the most intense opportunities that face that additional barrier of time. But it was also mentioned in our survey that sometimes co-production processes, you know, they can ask a lot of carers. They might be a really long process. And that might mean that, especially if relatively few carers are involved, that might be a lot of time being asked of quite a small group of carers, you know, and that can be an additional barrier. Respondents also told us that they were sometimes worried they weren't getting the variety of experiences that they needed. They worried, you know, they were just talking to the usual suspects, and they wanted to be able to reach out to a wider pool of carers, you know, so they were capturing the diversity of experiences amongst the caring population. A really interesting challenge mentioned to us by several respondents was actually around short time frames in terms of funded projects. So people told us that within the timescales that they're expected to deliver their projects, there often just isn't the time they felt to try out co-production. As one respondent said, they just need the freedom to experiment with co-production, to fail at it, and also learn from it. But they felt that when they were subject to really strict funding requirements or really strict timescales, it can be difficult to have that space to do so. Another challenge mentioned was around organizational culture, and actually how beneficial it is if we can be confident that people at every level of the organization are fully aware and fully committed to co-production. And we received a really interesting comment from a third sector organization who regularly engage with their local council. And they said that co-production within their local authority was actually really hit and miss. And they said that actually, until staff are measured on how they are co-producing, it would probably remain very hit and miss. So it's so important to think about how that culture of co-production is being embedded throughout the organisation, and how staff at every level are being supported and empowered to practice co-production in their work. We then asked in our survey about embedding co-production. So how is co-production anchored and formally based within your organisation? So we asked whether they had their own co-production policy, whether they had created a dedicated policy within their organisation around co-production. Unfortunately, most respondents said their organisation did not have its own co-production policy. However, some mentioned that co-production was referred to in other policies or strategies, for example, commissioning strategies. But it's really important to have a firm basis for co-production within organisational policies and practice, because it reduces the likelihood that co-production either won't happen, or if it does, it might be ad hoc, or it might be of variable quality. So it's important, to be confident that there is that firm basis within practice. Another positive example could be seen in Swansea. Swansea Council have a co-production strategic framework that they've created, which provides advice to departments all over the council about how they can embed co-production in their work. And there's also a co-production strategy for social care in the authority. Interestingly as well, West Glamorgan have created a regional co-production charter, which all of the partners have signed up to. And they've committed to taking meaningful action to embed co-production in their organisations, including through training for their staff at every level. We also asked about evaluating co-production. So we need to be evaluating and monitoring co-production so we can learn what is working and what isn't working. And carers clearly deserve a strong say in this stage of the process as well. Unfortunately, despite our 42 responses, we found very few examples of focused evaluation, with one person saying that their processes are just not evolved or well-resourced enough to enable them to monitor co-production. We did see, though, some good practice in Neath Port Talbot, where they mentioned that there had been evaluation interviews conducted following a co-production exercise. And these evaluation interviews included all of the decision makers involved, but especially the carer representatives. And if we are not evaluating co-production properly, then that means it's likely that organisations across Wales are missing opportunities for learning and reflection. But it also means that if carers have relatively limited involvement in evaluation and monitoring, then it might suggest that co-production is stronger at the earlier stages of the process, perhaps at the beginning or perhaps in the middle, than at those really important final stages where you take stock, you evaluate, and you consider how it went. So I'd just like to talk you through a few of the recommendations we're making in closing. So we believe it can be really beneficial if there is a continual opportunity for carers to come together in a local area to discuss issues and to co-produce with the local authority. So we would be really positive if local authorities established, if they don't already have them, well-publicised forums or panels or group or something along those lines to give a wider pool of carers an opportunity to regularly engage in co-production. Because otherwise we rely on ad hoc, perhaps, events, and it can be variable in terms of when and if co-production takes place. Of course, groups might not work for all carers, and some might prefer events, but we think there's a lot to recommend having that regular opportunity for carers to meet, to discuss issues, and to co-produce. We also believe local authorities and regional partnership boards should look at the committees or groups that they have and consider where additional carer representative positions can be created. So do you have a group within your local authority that looks at mental health services, for example? Well, do you have any carers represented? And if you don't, let's get some involved. Let's think about those opportunities. We also think that it's really good if regional partnership boards have their own dedicated groups on carers, where they can examine feedback from carers and suggestions, again, with carer representation. Clearly, it's really beneficial if replacement care or respite can be provided to carers to free up time to engage in co-production. But there does need to be a conversation about remuneration. Of course, it's something that being paid, it might not work for all unpaid carers, but carers are providing their expertise and their experiences. They deserve to be paid, and if at all possible, consideration should be given for that. And this could be brought together in an involvement policy, perhaps informed by the charter mentioned earlier. Moving on, we think there needs to be greater flexibility within funded projects to facilitate co-production, to provide that space and that time for co-production to take place. We think there needs to be a strong anchor, a strong formal basis to co-production in organisational policies. So the organisation knows that it is a cross-organisational commitment to co-production. Clearly, there needs to be strengthened involvement of carers in evaluation and monitoring stages. So we are learning the lessons of co-production and we can improve it continually. And finally, we believe organisations need to publicly report, but also proactively publicise their work around co-production, so carers can understand what is taking place and what they can get involved in. And there's that real public accountability as well. So that brings us to the end of my research presentation today. I am very happy to discuss this this research after today, and my email address is up on screen, along with our general email address and our website too. But now we have a question and answer session. So it'd be great to hear any comments or questions you might have. And if you don't get the chance to put them forward today, we'd love to hear from you afterwards. Thank you.
Brilliant. Thank you, Jake. So yes, we do have quite a few questions, so I'm going to run through those now. So the first one from Chris KP. With all of our local councils and health boards having cuts to their budget, do you think that this will impact on their ability to engage in true co-production with service users? So I'm not sure, Kay or Jake, if one of you want to respond with your thoughts to that.
Well, I guess we would say it shouldn't do, in the sense that even though we all appreciate budgets are very tight for local authorities, but it is at the end of the day a question of priorities and what local authorities choose to prioritise, and equally what they don't. And we would hope, of course, that co-production is something they would continue to prioritise. And really, if we truly believe in co-production, if we believe that involving citizens leads to better services, more efficient services, better targeted services, then really investing time and, yes, money in co-production is really just a down payment in the ultimate success of the project, because we will reap the benefits of better services, better targeted services, because we've actually taken the time to ask people. So I hope that's the approach that we would see.
Lovely. Thanks, Kay. Thanks, Jake. Kay, I'm interested to hear your thoughts on it as well.
I think Jake has just summed it up, sort of beautifully, really, because the involvement of parents and carers can make a difference to the use of resources that you have, even when they're limited, because it can, it can save that money in the long run when you involve us from the outset and the monitoring, because as Jake said, then you get the services that are needed. and the services that really are required.
Brilliant. Thank you, Kay. And Chris has responded to say thank you, that she hopes that they will as well. So the next question is one for Kay. Could we please have a link to where we can access the guidance booklets that you demonstrated there, Kay?
Yes, of course, all of the, there's links to all the booklets on Cwmtaf Morgannwg's Regional Partnership Board website. I've just checked, double checked as well that they're on there still, and they are. So I can send the link to Claire or put it on the group here, whichever is easiest.
Yep. So I think we'll send it around with quite a few of the documents that Jake has mentioned in his presentation, along with the report next week. So that would be great if you could send it to us, Kay. Okay, the next question is from Jeanette Munn from Swansea Council. Do we have an evaluation and monitoring tool that could be used nationally? I'm not aware of one, but I'd be interested to speak to the CoPro network in Wales to see if they would suggest one that we could use across Wales for that purpose. We'll follow that up, Jeanette, and see what we can find out. But good question. Okay, Ruth Ellie then from Tide Carers. So she says, you've talked about carers generically, whereas different groups have different needs. So for example, carers of people with dementia. Did you find evidence that local authorities or the NHS offer bespoke co-production opportunities to address these specific needs?
Yes, we did. So many of the local authorities, when they were talking about, for example, specific engagement events, those would be themed. So if they were creating, say, a new strategy for learning disability services in the area, then it would be, of course, engagement with carers of people with learning disabilities, for example. And you see some diversity of opportunities as well. For example, the Swansea Parent Carer Forum, of course, for parent carers and their specific needs. And I also mentioned there are a few cases where dedicated committees or groups have been created on certain themes. So I mentioned in West Glamorgan, they've got a group on mental health for carers involved in that area, a group on neurodiverse conditions for carers involved in that area. But of course, you make a very valid point that in some cases, general engagement with carers is the way to go. But there's always that place as well for dedicated thematic co-production as well.
Lovely, thank you, Jake. There's a couple of questions from Kerry Higgins. So one for Kay, she says a question for later, so I'll pass that on to you, Kay. She's also got a question for Jake, which is, do you think that a charter which is not mandatory is the wrong way to approach it? And do you think that separate groups is co-production by association? We know that we hear lots of work around co-production, but does that mean it's actually happening as documented, as in place regionally? And actually one of the things that the report says, which we didn't reflect today, which is obviously we take the examples that we've been presented in the survey at face value, and it may be that other stakeholders, obviously including carers, may have a different perspective on some of the examples that have been given. But Jake, if you could respond to Kerry's question, that'd be great.
Yeah, well, Kerry is of course absolutely right, and as I said from the outset, there is absolutely that division between consultation and co-production are two very different things. And as I also mentioned at the beginning of the presentation, some of the examples that were provided to us through this survey purporting to be co-production, I honestly didn't think met that standard. And as I mentioned as well, even some of the groups that I referred to, in some cases, there is a question mark over are they really more just consultation, which of course is better than nothing, but do they actually reach that full standard of consultation, of co-production? The charter, as you say, of course, isn't mandatory, but it's completely based, of course, on the Social Services Act, and the Code of Practice is even more closely, of course, tied to the Social Services Act, which, of course, does place legal obligations on local authorities to be practicing co-production. Where they are falling short, then it's for all of us, to collectively be spreading good practice, to be raising awareness, and hopefully encouraging all of us, to be reaching that higher standard. And I think, today and the report that we'll be releasing is also in line with the Welsh Government commissioned evaluation of the Act, which absolutely said that co-production is, in many cases, not being delivered as we would hope. So there's, absolutely a long way to go in this, and that's why we do research like this, and that's why it'll be a continuing focus of ours.
Thank you, Jake. The next question is from Peter Williams, who's on the Wales Mental Health and Wellbeing Forum. He says, are you aware of the work being done by the Wales Mental Health and Wellbeing Forum, which is on national guidance for service users and carers across Wales, and that this was commissioned by the Welsh Government? It's looking at engagement, which is high on co-production recruitment and remuneration.
I think we might be at least partly. So I believe so many carers volunteer with Carers Wales, and I can think of a carer who I think is actually involved in the forum. So it does ring a bell. But of course, we'd be very happy to receive some more information on this. Co-production is, something we won't be forgetting about after today. It's a continual focus. So please get in contact, and it'd be great to chat about that group too.
Yeah, I was going to say, Peter, we'd really welcome a discussion with you. So if you would be willing to pop your contact details in the Q&A, we'd definitely be in touch with you. So thank you for that, for highlighting it. Okay, the next question is from Tracy Williamson. We need to prepare staff to work in a co-productive way and really understand it. Do you have any thoughts on where to get funding for this, as there's almost no money in the NHS currently, although it looks like we're going to be doing some significant co-production work soon in mental health within her health board soon. This might be an opportune time to mention the Care Aware project, Jake.
Yes, so the Carer Aware project is a project that we jointly deliver with Carers Trust Wales, and it's about co-producing improved practice in relation to unpaid carers in both health settings and social care settings. So we in Carers Wales, we've been engaging extensively with social care and social work partners, and we deliver free training to social workers on working with unpaid carers and listening to their needs and preferences. But our colleagues and friends in Carers Trust Wales do deliver training as well for healthcare staff on working with unpaid carers. So if either of that training sounds potentially beneficial for your staff, then we can absolutely provide those details. I at least am not aware of maybe additional funding sources, but there is something, as mentioned in the presentation, about making sure that time and space for co-production is recognised and incorporated within funding bids. So I would hope that when all of us and any of us are, say, applying for funding bids or applying for contracts, we would say this is the time and the resource needed for co-production. There's an onus on funders to be providing that time and that resource to enable co-production. So there's something there for Welsh Government and for commissioners at all levels to bear that in mind when they're thinking about tenders and specifications.
Through the Care Aware project, there is also some funding available for health boards who are interested in co-production. There's some funding available for pilots. So, we can certainly put you in touch with the right person to speak to about those potential opportunities as well. Okay, I think this will probably be our final question, so I'm just conscious of time. This is from Amy Cole. So She says, hi, this is more of a comment than a question. There was a point made about remuneration and time credits impacting benefits in the presentation. She says, I work for Tempo Time Credits and just wanted to say there's no impact on people's benefits when using time credits. We believe time credits are a great way of recognising and thanking those who give their time to co-produce services. There's currently no cost in using time credits as we're funded by Welsh Government. Amy says, I would be more than happy for my details to be shared and to discuss further with anyone interested in exploring or finding out more. So Amy, we would definitely be keen to share your contact details. So please do let us know which contact details that we should give. I'm sure you're going to have lots of people getting in touch with you. So thank you very much for that. Okay, there's a couple of other questions and just some comments back on some of the answers that have been made, but that's all of the questions that we've received. So just want to conclude today by thanking our speakers. So thank you, Jake, for the work you've done on the report, and a massive thanks to Kay. You always speak so eloquently about the work that you do and the group that you work alongside in terms of co-production. We really appreciate your time, so thank you. And of course, thank you to everybody who's been on the webinar today. As I said at the start, we massively appreciate the interest that you're showing in co-production with carers. For all of you who are already involved in involving carers in co-production in your local authority areas, we massively appreciate that. And if there's anything that Carers Wales can ever do to support that co-production, then please do let us know. And then along those lines, obviously we have membership of carers across Wales. We have networks and social media, all sorts of communication mechanisms. And we are always looking for opportunities to promote to carers, opportunities to get involved in co-production in Wales. So please do think of us, if you're creating those opportunities, and we would be more than happy to share that through our networks and to our members and to carers generally across Wales. So diolch yn fawr iawn. Thank you very much. I hope you enjoy the rest of your day. And as I said, we will be sending out the links to things that have been mentioned today, along with the report, to all of you next week. So thank you very much. Enjoy the rest of your day.